Okay, we're here at ViVE, and we are speaking with Craig Samitt from Longitude Health. Welcome, Craig, to the Healthcare Wrap.
It's great to be with you. Thanks for having me.
So maybe we can start off with just the general vibe here at ViVE in terms of what you thought you might see. What are you seeing so far? It's day one, so we're kind of early, I guess.
You know, it's a heart-pounding experience just because it's Old Home Week, so I get to see hundreds of people that I know from prior lives. But it's also it's like an overwhelming shopping experience.
Ooh, that's a good way to put it.
For someone who wants to fix healthcare and make it better, and I've dedicated my whole career to it. You know, there's something really good about being here because you leave with 100 ideas for what you could do better. But it's also overbearing to some degree because you don't know where you should start. And of all the folks that you talk to here, what works and what doesn't work. Fixing healthcare is a journey, and you have to pick the right partners, and when you're inundated with lots and lots of options, it's kind of hard to decide who goes first.
I can hear that. You mentioned some of the things that have kept you in healthcare or maybe even brought you here in the first place. Can you give us a little bit of your background and kind of what were some of those prior lives?
Yeah, happy to. So I've sort of been an outspoken disruptor, I'd say, my whole career, and some would argue that I've been ahead of my time, that I've predicted that healthcare will need to change and how it will change.
Sure.
But the industry has fallen behind, and they haven't made the progress that they've promised. So I've been a value-based advocate for my whole career. I'd say earlier in my career, I believed that it would be physicians and health systems that would fix healthcare. And I did that for a while and was part of some awesome teams that did great work in transforming health systems. But then I realized that the market wasn't ready, or health systems weren't ready, or maybe the whole industry wasn't ready for value. So I went to health plans thinking that, well, perhaps I could help health plans be better partners to physicians and health systems and enable them, empower them with tools and capabilities that would fix them. And I did that for a while and, had the honor of working at Anthem Elevance and then as the CEO of Blue Cross Minnesota. And similarly made some good progress, but at some point hit a wall where you realize that you can only go so far as a transformative agent. We joke in the blue plan world, the expression blue tape or blue goo, that you just get locked up and paralyzed with the pace of change. So recently, I believed it would be disruptors that would fix healthcare, and retailers, tech, or startup companies that have done some innovative stuff, but have struggled and they've had trouble scaling, or haven't proven their value, or have gone out of business altogether. And so you could argue that my career has now come full circle, that I get to do health system transformation again. And this time, I believe we've got the right capabilities and the right tools and the right interest in having health systems, in many respects, in the driver's seat of change in our industry.
About to say, I think that echoes a lot of the conversations that we've had. We've talked through the health system side, the health plan side a little bit, and definitely the disruptor side. We're on that same kind of rocket ship, just kind of keeping an eye on it and seeing what was going to happen and how things could truly transform. And
so maybe I should be interviewing you because I kind of want to know, we have this sandbox or laboratory to really experiment in ways that systems haven't before. So maybe you can help guide me to what works.
Sure.
Because that's exactly what we're going to build at Longitude.
Well, I think we have some perspectives. One of them is, we certainly believe that the future of digital health might come through connected fitness. And so on the show, we've been bringing on groups like Oura Ring. We've been chatting with Whoop and some of those other wearable technologies. And so we think at some point that might become a little bit more ubiquitous and help patients actually stay healthy and well before they actually need clinical care. And so would be curious what you think about that.
Well, I think first and foremost, whether it's digital wearables, I think we have to presume that everything technological, digital, virtual, or AI-powered has tremendous opportunity to transform our industry. And, one of the things that has held us back, early in my career, I believed that if health systems very simply, or health care in general, simply adopted innovations that other industries were deploying, that we would be better off. And we've been behind, and we've been slow, and we've been distrustful of technology. When I think that devices, information, computer-driven decision-making to sort of enable and align with clinical decision-making, or in some instances replace it, at least if not supplement it, is the way of the future. In general, I'd say in healthcare, we tend to solve problems by working harder, when technology and digital solutions actually help us work smarter, not harder.
Sure. How do you, Craig, as a physician, work with other physicians who might be a little bit hesitant when it comes to technology, to get them to see its value?
Well, I mean, I think that there are a variety of ways that you can do that. I remember earlier in my career, I got one of my CEO jobs because I gave a talk about the art of physician persuasion.
Oh.
It's probably one of the things that at least population health companies have to get right. You know, if you create the better mousetrap and you fix process and you fix technology, but you don't fix people, you don't sort of empower the physicians and get their attention, then you don't make any progress. So I think there are a lot of things that physicians do respond to. I think they're scientists, so they respond to the evidence. And I think if you present things that truly work, physicians tend to adopt them. I think they're competitive. So I think if you show information of where they're falling behind or how they compare to their peers, I think that changes physician behavior. I think physicians want to do the right thing. I mean, I think if you demonstrate something that truly will believably improve outcomes or service, they're willing to at least try it. So I won't go through the whole list. There's probably 10 levers you can pull. It's one of the reasons why it's been helpful for me to be both kind of a physician and a businessman, because in many respects I feel like I've spent my whole career as the translator or the bridge builder between the way you think as a physician and as a clinician and the way we should act and work as a business people or visionaries in fixing healthcare.
Mm-hmm. I think that's a really interesting perspective. When I used to work in hospital systems, I noticed that even some of our senior physicians who are in leadership roles, I could tell didn't quite understand the business of the health system. They certainly knew, obviously, the clinical stuff, but when it came time to talk about pricing or contracting, some of those things were just a little bit outside of, I think, their knowledge. I don't think necessarily medical schools talk about that. And so I could totally see where someone with business skills and who's also a physician could start to marry those two worlds.
Well, and I think it's both understanding as well as common interests. So I just had a meeting this morning with all of the leaders from all of the systems in Longitude to present what we're building in PHM. And one of the comments they made is that we did a very good job of listening to and identifying a common thread of needs and interests that span these very different health systems and span both the clinical enterprise as well as the business enterprise. And so it's a hard thing to do, but beyond just educating, I actually think that one of the things we haven't done in healthcare is to find common ground. And, I have to believe that better care at a lower cost and sort of easier work for the clinical workforce is something that we should all be able to get behind, and we should be able to find a unified strategy that delivers on all three.
Okay, so tell us about Longitude. So it's still quite a relatively new venture. A lot of people have interest in it, but just tell us about the organization itself, and then we'd love to hear kind of what your role is and kind of how that's all working.
Yeah. So Longitude came about through both the vision and the foresight of our former founder, Paul Mango, who we suffered a tremendous loss in both Longitude and our industry when he passed, a true visionary, luminary, and friend and mentor. He and four tremendous health system CEOs that are visionaries in their own right discussed the likelihood that the capabilities, the skill sets, the strengths that health systems really need to have to succeed in the future are a bit different than the ones that were required to be successful in hospitals in the past. And I hate to call it sort of seeing the writing on the wall, but I think that's the best way to describe it, that whether it's, health plan leverage or whether it's the aging of our population, what we think is going to happen with Medicare, economic policies, the costs of doing business in health systems, that all of those things converge into the need to think a little differently about how health systems should function. So these organizations came together and both agreed that the future was going to look different, but also agreed that they couldn't design the solutions by themselves. We've long used the expression that healthcare transformation is a team sport. If every part of the industry simply tried to solve all of healthcare on their own, we'd make very little progress. Or if they tried to solve it at the expense of another critical player in the industry, we'd have a problem. So I think these health systems said, well, we can do this. There are all these capability sets, whether it's population health capabilities or RX capabilities or consumer capabilities or analytic capabilities. We could do all these things on our own, but they certainly wouldn't be as effective and powerful or as efficient as if we could do it together. And that created Longitude. They agreed that they would prioritize where they should start first. They started with 40 different ideas and concentrated on 3 to start. RX, Longitude RX was born, value-based care, Longitude PHM was born, and consumer collections and for financial support and management for consumers, and Longitude FX was born. I'm leading the Longitude PHM OpCo, and in essence, it covers everything related to value, risk, and population health performance that these health systems, as well as their provider-sponsored health plans, influence in their markets. I have the sort of a very unique scenario of leading an organization that is sponsored and governed by nonprofit health systems who happen to also be the investors and overseers, who happen to also be our primary clients. So in many respects, there's no better alignment of interests than the creation of an organization like this and the work that we have planned in the value-based care population health space.
So what gaps is that addressing that weren't out there, that you weren't seeing solutions for already, or that just the team, that Paul was seeing out there that weren't, immediately addressable by things that are already out there, that there was a reason to create the organization this way?
Well, I think that, the sort of the broadest possible vision, I've long believed that single organizations could deliver on the promise of the triple aim. There are very few organizations that can demonstrably prove that they're delivering high service, high quality, good access, and affordability to consumers all at the same time. In fact, back when I was in Minnesota, we really wanted to know how many health systems were kind of delivering on all cylinders in that regard, and there were none. And even when you lowered the threshold of what counted as good, so you could say, okay, are you in the upper half or in the upper third or in the upper 2/3? It was hard to say that there were folks that were good at everything. And frankly, if you're going to deliver on value with all the things that matter in value, you have to be good at all these things. And, I've long said that just because you take value-based payments doesn't make you an accountable care organization. You have to demonstrate you're good at what you're being paid for. And so the intent, the gaps we're trying to solve with these systems is, what would it take for these systems to not just be good at all those things, but it'd be in the upper quartile or the upper decile of performance in all those things all at the same time. And for us, it's, there are several levers that you pull, and this as well as, if you're going to be focused on sort of a consumer orientation in healthcare, what are the primary interventions that deliver on that? The same with access, the same with quality outcomes, the same with cost of care. what are the levers you predominantly pull? The intent within PHM is that we will prioritize all of those and either build or partner or buy, or even more importantly, integrate solutions that are already within the existing Longitude and future Longitude systems into a sort of an integrated solution portfolio that helps every system deliver on the expectations of the triple aim.
There's a lot in there. So remind our listeners who may not know the health systems that are part of Longitude.
So the current health systems in Longitude, and it's an awesome first set, are Providence, Baylor, Scott and White, Memorial Hermann, and Novant. I'm on a plane a lot, given all the markets they're in, and I don't live in any of their markets, so it makes it even worse. But there are several more that we expect will come online within the course of the next year. And obviously what makes us different than others, there are other alliances, health system alliances, that are trying to solve health system problems. Some of them are studios that they're incubating solutions. Some of them are funds where it's really more of a co-investment strategy. We're an operating company. Our focus is on moving the operational needle for these systems, which makes us a bit different. And because these systems remain independent and there isn't an obligation that they have to do things a certain way, that they will pick and choose where they have the greatest needs to deliver value, we're probably a really attractive option for health systems to become part of our alliance. So for that reason, we expect that we will grow quite rapidly over the course of the next year or two.
That's fantastic. I know we've been tracking some of the different alliances, and some of them are so rigid, to your point. Allowing that flexibility should open up to more to join and consider it for sure.
Yeah, I mean, it's, I give a lot of talks about sort of what the options are that health systems face that are aspiring to be different. And fortunately, they've got lots of different options. We obviously are biased. We think we've got a good option to offer. And part of it is I kind of know how health systems think, what their inclination is. I mean, the frank reality about our alliance or any alliance is our system colleagues, and myself included in the past, have sometimes been risk averse or slow to move. Or distrustful of innovations, or lack of progress in innovations. And, I think we've got to make this live and breathe effectively for these systems so that they adopt and they move more quickly. And that's why all these alliances are good, because our hope is that it will instigate change in the part of our industry that has the greatest opportunity to lead that change.
What can you tell us about where Longitude's headed, or focused at least in the next 6 to 12 months, kind of like a short-term horizon?
Yeah, so I think that our priority is prioritization. There are a lot of different needs, and I'd say the needs fall into population health improvement opportunities. When we think of how these organizations do in value-based care, where can we create immediate lift in their performance? The second is, interestingly enough, all four have provider-sponsored health plans, each of which are subscale, underperforming, and have great room for improvement. Virtual scale, through a health plan as a service type offering to these plans is of tremendous value to allow them to remain competitive from a health plan perspective in their markets. And then they've got analytic issues. So we've got sort of several dozen levers we could potentially pull, and the important thing for us in the coming year is to rank order those levers and then begin to pull them so we start to generate immediate value. And then growth is a priority for us, because if our greatest opportunity to do better is to scale these partnerships, then achieving that scale sooner rather than later is an important place for us to focus first.
I love it. My last question for you is just what does consumer-centered care look like to you? Like what's different than the type of healthcare that's offered now, and just in general, whether it's related to Longitude or not? What does that look like to you?
I mean, I think I went to medical school and did my residency training at a time when consumer-centric meant that you should listen to your doctor's perspective on what you think is good for you in healthcare.
Interesting.
That's not consumer-centric.
Interesting.
That is paternalistic. And I'm not sure our industry has changed a whole lot. I mean, I think that we don't necessarily focus on what good for healthcare looks like through the lens of our patients. And I even remember thinking that, you know, one of the things we want to do at Longitude is to come up with a new definition of what success and value looks like.
Oh, wow.
You know, because it's if you talk to health plans, their definition's A, health systems B, patients, consumers C, doctors D. So we're not sure we're measuring the right things. And you could argue that the most important measurement set of all is what our consumers tell us is the most important thing. I remember when we first started, you know, measuring quality outcomes, we talked about the fact that in the eyes of the patient, quality isn't just clinical quality. It's access, it's service, it's partnership.
Maybe achieving some goal in their life.
Exactly. It's personal. It's not numerical. And so in many respects, I think that if we engage the patient and we deliver outcomes that they envision they want and need, that's going to be a major step forward in kind of how we think about consumer-centric healthcare.
Love it. Love it. Well, when you guys come up with that definition, we'd love to hear about it on the show and bring it to our audience.
And if you guys have any insights for where we should start and where we should end our work, you know, please let me know. We're listening and we're learning and we're immersing ourselves. That's why I'm here at ViVE, just because we're immersing ourselves in the people who are doing interesting things.
Love it. Well, I'm sure our audience could reach out to you with some ideas on LinkedIn.
Please have them do so. I'm talking to lots and lots of people each week.
Yes, love it.
Really appreciate the time, Craig. Thanks so much for joining us and giving us a lot to think about.
Thanks so much.